How's it going here? So I mentioned this a few times before, and I recently posted something on my YouTube channel. I've got the owner and founder here of WBT, and we both have a similar surgical history. We both did quad LL, or a bit of a misnomer. We both did tibias and femurs, and so I thought it'd be interesting. And I also got some questions pulled from my viewership, and some other questions too. So we have a collective pool of questions here that we're going to pull from. So yeah, I don't know if Ibrahim wants to say anything at this point, or otherwise we can just dive right in.
Hello, I'm Ibrahim Alğan, 31 years old, founder of the company Vanabitoldur.
Let's dive into the questions here. First one, how many centimeters did you achieve with 2 operations? So the total height difference that you obtained.
She's 1.60 meters tall before the surgery. She was at the average height for girls in Turkey. I had 2 surgeries. I grew 6 centimeters. I grew a total of 12 centimeters. Now I am 1.72 meters tall.
Okay, yeah, no, I achieved, I believe it was 11.5. Yeah, just a little under 12. My initial height was about 174. I'm not sure what time of day that was measured, but I gained about 4.5 inches in total. So pretty significant difference. Let's see, and which method did you use? I know that I mentioned throughout several of my videos that I use LON both on the tibias and femurs. Which did you elect to go with?
When I had my first surgery, I was 24 years old in 2015. There were not many methods in Turkey. Only the name of the LON method was mentioned, but I haven't seen any examples of it in Turkey. Well, my doctor also recommended the Holyfix method, so I chose it for my first surgery. Honestly, it was a difficult method. I lived with the devices for about a year, just like Elizarov actually, except the external device is slightly different, a monolateral system. For the second surgery, I chose the LON method. I had it in the year 2020. I grew 6 centimeters. My first surgery, as I said, lasted about a year, but my second surgery was over in about 2 months, and it was much, much more comfortable than the first one.
No, there are definitely advantages compared to just having that external frame. Yeah, so for me, it was pretty much immediately after. I think it was 1 week after removal of the tibial fixators, I did the femurs. So it was good in that it was really compact in terms of time, but there are certainly some drawbacks because I haven't regained all my flexibility from the tibias, and so it made going into the femurs more difficult. So a double-edged sword, but yeah, happy now that I did it that way, I guess. Let's check out some other questions here. Let's see, I'm gonna skip some of these. Did you face any serious complications?
This is a difficult question. Honestly, I could maybe answer this question for hours. Normally, for example, the surgery at 24 years old, at the age of 24, a person's bone should heal quickly under normal circumstances. I believe my bones are strong too. I had tested it a few times. However, despite my bones growing by 6 centimeters, it did not heal properly. That is why for 6 centimeters, I had to wait 15 months and 12 days. Of course, during this period, I also got an infection due to open wounds. Since my first surgery was from the femur, my knee couldn't bend at all. This was really painful for me, honestly. There was pain. Also, since it took so long, I felt under psychological pressure, to be honest. Honestly, my second surgery was also on the tibia. However, there are a lot of nerves in the tibia, since almost most of the nerves pass through the tibia, especially during the removal of the device. I experienced neural problems. Nerves are the dark side of medicine. Despite a lot of research, I could find very few solutions. All that I've been through, honestly, was very difficult. But right now I'm good. I don't have any complications at the moment. Just there are 2 nails in tibian. However, there is no pain or discomfort. Right now, as I was before, I'm pretty good. I'm healthy. I'm continuing with my normal life, but I just remembered it was hard, honestly.
So for me, I had a few minor ones. I wouldn't say anything too significant. One of them was on the femurs. It was either 1 or 2 infections. And the reason is just because I was working a lot. I was working like 70 hours while I was doing this, and I didn't have enough time to follow the dressing change ideal frequency, which is about every 2 days, especially for the femurs. I think there's on average more exudate compared to the tibias. And so, all of that exudate moisture is conducive to bacterial growth and in turn, infection. So I didn't even have an AC in my car. It was 100 plus degrees and I'm working 70 hours of a week, not doing the dressing changes as frequently as I should. So I got a couple infections, took oral antibiotics, knocked them out. That was fine. Had some nerve issues, mostly with the tibias. At one point, it was really bad. I had alternating sensation of hot and cold, and that did eventually resolve completely. Currently, I have 0 issues with nerves, flexibility, anything. So it resolved completely. And I can run, I can sprint, I can jump, I can do all that stuff without limits. So that's good. But nothing, I guess, too terribly significant, but I did have quite a few minor issues, I would call them. Have there been significant changes in your private life as a result of leg-lengthening?
Well, actually, it's a bit of a complicated question to answer because short stature was like cancer to me. I always compare it to cancer. Right now, I just feel normal. I don't have a feeling like I'm very happy in my life, very low-key. But anyway, my goal was to get rid of these cancerous feelings, feel completely normal. Right now, I actually feel normal while walking on the street. First, I used to always think this is shorter than me, this is longer than me. Whenever I met anyone, this was the only criterion I paid attention to. When meeting a new person, looking up was a very bad feeling. That's the only thing I focused on. Sometimes I had to get in front of people and give a speech. My whole life was dependent on this. In fact, I didn't even know half of my university friends during those 4 years. Moreover, I am a psychological counselor. I completed my university education in this field. Normally, I should be a social person. I should be a confident person because due to my profession, I instill confidence in others. But I never had it. It was suppressed because of the height. After the surgery, all these things ended. I am incredibly confident. I'm not saying I'm a very good leader. I'm completely normal. I feel normal now. I have normal problems. That was my goal. So I feel lucky for myself.
No, that's good. It sounds like you had a positive outcome. And I know most of it is psychological, and I can certainly empathize with comparing yourself to other people. I live in the US. The average height here is crazy, especially if you consider an age-adjusted average. It's like, 5'11" or something. It's pretty tall, 5'10", 5'11". So, at 5'8", there is a pretty big discrepancy. I could report things very similar to that. I can report that people seem to pay attention to me more of both genders. They give more credence to what I have to say, I'm just given more respect, not explicitly as far as what they tell me, but you can just tell, if you're aware of those social cues, you can tell they're giving you more respect. You get more attention from girls, it's no, everybody's aware that girls like tall guys. That's how it is. You go from 5'8" to 6'1", it's going to have a positive impact. So that's also been something that I've seen. But again, no mystery there. I think everybody kind of expects that. So it's exactly what you would expect in that area.
Also, I want to say that I recently started martial arts. I always wanted to before. But in Turkey, there are very original jokes, especially for short people. That's why I can't seem to start. They used to call him the pocket Hercules, the atomic ant. But because I'm taller now, more confident now, and actually feel normal about it, I recently started martial arts. I am planning to shoot good videos, beautiful videos, and upload them soon.
Again, I can relate with that. I feel like once you eliminate that factor in the background, which kind of has this influence on every aspect of your life, then you can focus on other things that are more important. For me, I felt like there was this overarching efficiency, which kind of sounds like, Ibrahim, what he was talking about too. So once you eliminate that, it's like you have kind of a newfound motivation or energy to focus on other things. In his case, martial arts. I'm trying to do more calisthenics now. So I have goals with that, as I continue to regain my athleticism. So, I understand what he's talking about. Makes sense. Another question I had, this is something that comes up a lot. What about reception? Like, how have your friends and colleagues been receptive to you getting surgery. Like how has it affected you? How has it affected your friendships? Yeah, I guess I've got some stuff to say about that, but I'd be curious to hear what your experience has been.
After the surgery, my family noticed it, but I hadn't told them that I had undergone limb lengthening surgery because I don't think they would understand, because I don't think people can empathize with a short person. They can't feel what a short person feels. So that's why I didn't tell anyone about the surgery, but they noticed I got taller. They were told I had bone straightening surgery. But it's like this. When they paid the fee, I was saying that the bones also healed, and
I actually knew my family understood, but laughed.
I was passing by. They weren't saying anything to avoid embarrassing me. Then I went back to my duty station. So I returned to the place where I used to teach. For example, the hairdresser I went to said to me, there's something different about you. I notice it, but I can't figure out what it is. You look a bit thinner, you look taller. In the same way, I also remember this. I was sitting next to a teacher friend. Normally, he was looking here. I was looking at him from here while standing. We had to stand up like that. As soon as we stood up from an equal angle, he said to me, "Hey, you've grown taller." I couldn't believe it. I kept saying, look, I have some high-heeled shoes and so on. But now it's him.
There is now a reality in front of it.
Because it was like this before and then it became equal, I had to confess to him, but I say, don't tell anyone. A few minutes later, I went to join my other friends. They also said to me, you've grown 6 centimeters. The news spread in a short time. Actually, the spread of this news was good in a way. I felt a bit relieved normally. I thought I would be stressed, but now I don't care anymore. Now people have surgery to grow taller, or I don't care about comments like, you've grown taller after surgery or you've gotten taller later on, because now I am taller. I don't really care what you think. Plus, people only look at the result. I'm happy inside as well. I notice the looks of the people around me changing too. That's enough for me.
No, that kind of makes sense. I was in a kind of a similar position in that I was kind of forced to be forthcoming about it because I was working throughout the entire process. So my colleagues were able to see me get taller. So there's really no way to explain that away. And it was a pretty significant height difference, especially because I was doing 2 back to back. Maybe if you have like a pretty big gap between seeing somebody, you can get away with 1, but 2 back to back, it's just, that's pretty significant. That's when you go from looking up to somebody to looking down, like 4.5 inches when you're talking about stature is, it's pretty big. But people, they were supportive overall, pretty, it was pretty positive. So I was talking about how receptive people were, how they reacted. So overall, it was positive. There are going to be some people who, usually not directly to me, but I find out in like a roundabout kind of way, something negative. But for the most part, it's been positive. And for those people who have anything negative to say, usually they're not in a position to really empathize with what I was going through, kind of like what Ibrahim was talking about. It's just, unless you've been there yourself, you can't really understand it. Certainly not as a female, even if they're comparable in stature. It's a very different thing. If you have a girl who's like that, it's like kind of an endearing feature, but you have a guy, it's emasculating, and, they're just not viable for a lot of things. And that's just the way the world works. You can't change it. You can only change yourself. But yeah, it's kind of, I guess, everything in summary there. What was, there's something else I was going to ask you. Proportions. It's one of the most common questions that I get. Ibrahim, do you have any concerns about proportions, or do you want to weigh in on how that affected you and how it generally affects most people?
Surgery in this regard, I was actually lucky. As far as I can tell, shorter people generally have shorter legs. My legs were also short compared to my torso, especially every time I went to buy pants. I would definitely I would shorten the length of the pants. After the surgery, it started to look not abnormal, but actually more normal. Because especially when I started running and doing sports, when I kicked, I had very short legs. I have legs. I couldn't cross my legs. because it was very small. So I had my first surgery on my femur to make it more aesthetic, more beautiful. After the second surgery, actually, I was worried. Would there be any disruption in its proportions? Would there be any loss of balance? But now when I wear a suit or dress casually, it looks much better on me. I think I always get good feedback from my surroundings. It's good in that sense, but people may still need to pay attention because everyone has different heights and aesthetic understanding is also different. And because this is a cosmetic surgery, everyone asks this. It can answer the difference, but still, since we already grow a millimeter a day, it's very easy to control that. People can stand wherever they want. All right, it was quite satisfying for me.
And myself, we were very similar as far as being candidates for LL. We both had proportionately short legs, and the result was quite aesthetic. So I know that's a very common concern. I've had a lot of people ask me, and I feel like I couldn't generalize an answer for everybody. It really depends on the specific person. Sometimes you have people who naturally have very large legs to torso ratios, and they might be a candidate for maybe one surgery, but I feel like if they're doing two, then it might push them into the uncanny territory. But kind of goes back to what Ibrahim was saying, to where you just want to be cognizant of where you are, look at where you are in the mirror, and just, realize that it's changing. So try to be in tune with that. That's kind of where I was too. I was like, it's going to be 6 to 7 centimeters on the femurs. And I ended up stopping at 6 because I was like, it looks perfect. I'm not going to get greedy and risk looking what would be, in my opinion, unnatural.
Okay. Another question.
Here's a question that I get a lot. So something definitely worth discussing, and something that anybody should ask about something that they're considering doing. You want to ask somebody who achieved what you're setting out to achieve. You want to ask them if they have any regrets, if it was worth it. So a lot of people have asked me that. So I don't want to say anything that might potentially bias your answer, but what are your thoughts about that? If somebody asked you, was it worth it? Would you do it again? Do you have any regrets? What would you say?
Of course, to this question, someone who has undergone surgery might give a different answer. In my opinion, depending on the level of obsession, medium level of obsession, low level, high level, they may give different answers to the question. I'm probably at the top of this chart, the most obsessive person. That's why I suffered a lot, faced many difficulties. Despite that, I have never regretted it. I never said I wish I could go back. But many people who have experienced the difficulties I have could regret it. This is entirely a personal matter, and it depends on the past experiences or what it hasn't experienced. I didn't regret it. If I could go back, I would probably have the surgery again, because before I was missing out on life. I wasn't living. Now I see myself as a normal person with normal problems. That's why I can say it was worth all the difficulties I've been through.
Yeah, no, I totally get it. I feel the same way exactly. For me, well, you're talking about, Ibrahim, you're talking about eliminating these feelings, these bad feelings. It's the same thing like with me. Some people will say, oh, it's psychological, and it is, but that's kind of like a downstream effect, The fact is, it affects how people treat you. It directly affects your quality of life. Anybody who says otherwise is either completely ignorant of the data, or, I don't know, they're living in some fairy tale. But people sometimes mislabel it as like body dysmorphia or something that can be resolved just by some sort of psychological tweaking or training or counseling or something like that. But the point is, your reaction is pretty normal. You're not being treated as well. That's how the world works. So you're in a position to change yourself, not the world. And so it sounds like we had a similar thought process with that. So, I had the same lines of thinking. I was like, no, I'm going to fix this. So that way I don't have to think about it anymore. And now that that body dysmorphia, or whatever you want to call it, is gone. I don't have to think about it. I don't have to think, oh, gee, if I'm talking to somebody, she's just thinking he's too short. I don't have to think that anymore. So it's nice.
Is it a psychological announcement? I got my degree. So I'm the one people say go to a psychologist or go to a psychological counselor. Normally, I couldn't figure this out myself. So that's why I'm quite
Absolutely. I think it's the only reasonable conclusion that you can come to. If you're going to be a realist, if you're going to look at the world in any real sort of lucid way. Anyways, I think we covered most of the questions. There's another one that I get from time to time, scarring. Ibrahim, do you have any concerns about scars? I mean, personally, I'm not too concerned. And in fact, when I did the removal surgery for the internal nails, I was able to get a revision done. So I was able to make those, what were they? The distal femoral pin site scars, which were initially deep and pitting, kind of, a side effect of LON. I was able to get those converted into nice linear scars with kind of a smooth topography. So they're actually looking nice. I haven't taken any pictures yet, but I'll have to do that at sometime soon. Did you have any concerns about scars? Or has anybody made any comments about your scars?
Honestly, being a man here has its perks because it is also a bit hairy. Because of my build, it covers it up on my legs, and at least for me, though, it causes fewer problems. But still, my first surgery was the hollow fix method and device. It got more deformed because it stayed on the leg for too long. Still not to the extent that it would bother me. Much less on the tibia. Normally, I know the solutions for this. I know how to fix it. I know how it will be treated, but it didn't bother me that much. It never came to my mind. I didn't think about it. It's not a big problem for me. If I had seen it as a problem, I would take more precautions. It would be much less, but I said it was never a problem for me.
No, it hasn't affected my life at all. I often wear shorts, when the weather permits. But, that and it not being just usually for guys as much of a cosmetic concern, and then having the hair on top of that. So all of these factors kind of make it pretty insignificant. Then I also tried using some creams. And then I'm also going to get laser removal at some point, but it's not high on the list because nobody even talks about it. I'm wearing shorts. They're in plain sight. Nobody says anything. So, at some point when it's really convenient, I'll get it done. But yeah, I don't have much of a need for it now. Anyways, I think we covered most of the questions that I had set out here. Ibrahim, did you have anything you wanted to add or ask or interject?
What does he think about others having this surgery? Is it recommendable, according to him, who should have this surgery and who shouldn't? What are his thoughts on this matter?
No, that's a very good question. I think anybody considering doing it needs to first off educate themselves. They need to know what it entails, the mindset that they kind of have to have, the length of the recovery, what they can kind of expect going into it. Because it is a very big investment, and I'm not talking about the monetary component. It's kind of pricey, it's as cheap as possible in Turkey, which is why I went there. But still, when I'm talking about the investment, I mean the time investment. There's obviously a lot of discomfort, to put it very lightly. For the most part, average patients, including myself. And yeah, it takes a lot of time. So I couldn't say that everybody is a candidate. It needs to be something that your stature needs to be something that weighs on you significantly, I think, to warrant doing it. Sometimes I hear about guys who are 6'2" and I want to be 6'4". I'm like, no, I don't think that's a wise decision. I absolutely would never advise somebody like that to do it. But some do, but obviously that's not most. So just realize that it's going to be long, it's going to be painful. There are the proportions to take into consideration, but for the most part, patients can get away with at least one surgery. It's where you get into two surgeries that there are potential issues for most. So, and there really isn't a one size fits all sort of the answer. It really depends on the person. It needs to be something that is having a significant negative impact on their life, because what you're doing, the intervention that you're doing to correct it, is very significant. It has a very high time cost. You're paying in terms of your time, discomfort, and money. So you have to know that.
My answer is personally, if I was sitting in the psychological counseling chair right now, and if there was a patient in front of me who asked if I was suitable for this surgery, the question that should be asked to him is, what will this surgery change for you? To these questions, if I can give a good answer and fill in the details of these questions, then we can recommend it or not. In my opinion, the deciding point here is this. Short height changes a person's normality For example, because I am short. If I am hesitant to get up and meet other people, my social life is very bad because I am short. If I am failing because of my height, it seems there is something abnormal here. But if the other criterion is that it takes a long time, so if this is a temporary thing, lasting 3 or 4 months, surgery is not recommended. But if it lasts more than 6 months and never goes away, if past memories keep coming back and getting refreshed, I still recommend seeking psychological support. If it's still not resolved, I recommend going to an orthopedic doctor, talking to them, and making a decision after getting enough information. I say these are also okay. If the patient has courage, enough financial power, and enough time, then we can recommend it.
No, I would second that completely. I think it's always smart to go from least invasive to most invasive. And so limb lengthening surgery shouldn't be the first option. Make sure that it's really going to solve the problems that you think you have. And if they're long-lasting problems and you've exhausted everything else that is not as invasive, and pretty much everything is less invasive than LL, then you might be a candidate for it. And then still you have to educate yourself. The onus is kind of on the patient in that case. So yeah, no, that was a good question. Any other parting questions or comments?
Now, in the end, both of us had this surgery, and those who had this surgery will watch us. Maybe those who want to have it will watch us. That's why our experiences are important in everyday life. What were the most effective tactics for making it spin? I mean, which is more effective in physical therapy, swimming or running? Jumping, going to the gym, or doing nothing, or focusing on your concentration? What are the most useful tips? If he could talk about these, at least we could be helpful.
I also get this question quite a bit. So physiotherapy, definitely important. I always emphasize that. I did a lot, especially with the tibias. I know that while I was in the hotel, I went to the physiotherapy floor, I think like 4 times a day. Like I was there a lot. And so I had a very good outcome. I think most of these things patients or prospective patients are aware of. They're all kind of downstream effects, though. I would say as far as something that would encompass everything or would affect everything, more specifically, would be keep your reasons close, like focus on why you're doing it. Because if you let that get away from you, then it's really going to seem like a challenge. And it is a challenge, but it's much easier if you remember why you're doing it. But other things like good physiotherapy, stretching, good nutrition, stuff like that. I mean, I think most patients are aware of that. There really aren't any simple tricks there. I guess when it comes to the lower segment of tibias, you want to focus on the Achilles because that's the number one pitfall that I see. So if you have to emphasize anything, emphasize that. Emphasize stretching the Achilles. With the femurs, it really depends on the method. I think overall it's not as prone to complications as the tibias, but really you just got to focus on your reasons and, play it in your head often.
All right, then let me answer. The enjoyment is already decreasing. This is the last record's enjoyment. My advice, of course, is to start before the surgery. Especially flexibility should start before the surgery. I highly recommend doing stretching exercises before entering the price. If you do stretching exercises along with swimming, it will be an easier process. Young people can even exaggerate this a bit and get support from a physiotherapist. If they can get professional support, this would be much better. Even after the process, I recommend giving emphasis to physical therapy. For instance, I myself, even though I was knowledgeable on all these matters, being knowledgeable was not enough. Because I thought I would get better. I thought I knew this. I said 6 centimeters would be very simple for me. I said this for myself, but there's an Achilles tendon in the tibia and it is very difficult to stretch. I did not pay attention to my physical therapy during that time. Later on, fixing that took me months. I hope I can fix in a month what I neglected in that process. Maybe 2 months, 3 months, 4 months. I had to struggle for a long time just to get my heel to touch the ground. Another piece of advice, if you had surgery from a tibia before removing the device, it's better to make sure you are flexible enough you will have a healthier device removal process. Other than that, honestly, the most important problem we face is the amount of extension. Concerns are always like, I spend this much money, dedicated this much time, I'm very anxious. It should extend a lot, but this is not about that. This is entirely a medical and scientific event. When the doctor says stop, you must stop. Most of the problems we encounter are usually, they say I'll extend an extra millimeter, 2 millimeters, 3 millimeters, 5 millimeters, but this is very dangerous. There's no door for this game. Especially on this matter, I advise them to be careful. They should definitely follow the doctor's instructions. And that's all I have to say on this topic.
Yeah. Ibrahim, thank you for taking the time to meet with me. I appreciate it. And, I look forward to you sending me videos as far as your martial arts and stuff. And I'll be sure to send you stuff, showing my new athletic ability, which is coming in quite nicely. So thanks again.
Thank you very much. I think I hope it's a useful video for the viewers. If it's like we'd like to make more videos like this, thank you so much. Thanks a lot.